In this week's breakdown, I'm going to be covering a ligament that runs from the tip of the sacrum all the way up to the base of the C7 vertebrae, the supraspinous ligament. What's up, everybody? Dr. Matt Major here, creator of the Peak Method and founder of the Soft Tissue Revolution, where we teach massage therapists a new treatment method that focuses on working smarter, not harder, allowing them to make well over $100,000 per year with less than 20 hours per week in the clinic. No gimmicks, just results. So supraspinous ligament, it's really important in overall stability, function, and movement, basically from the lumbar spine all the way up to the top of the cervical spine. When it gets into the C7, it actually becomes the nuchal ligament. But ligaments really cause a lot of problems. So ligaments over time with like bad posture, especially sitting in like a very sedentary posture, they get really stretched out. And when they get really stretched out, they don't get enough blood flow, they don't get enough oxygen. And what happens is the body starts to lay down scar tissue in there, making the ligament like weaker, less flexible. It doesn't get a lot of innervation from the spinal cord and from the brain itself, so they don't really notice pain when this is happening. So over time, what happens is the ligament runs down the back of the spine there, and it can't allow the spine to kind of open up, and it creates like a nutcracker effect, just like this. And what it does is it puts more pressure on the joint, on the disc, around the surrounding muscles, and really causes a lot of problems. So then eventually people kind of present with like back spasms, disc injuries, sciatica-like pain. But a lot of times that started because of the ligament. A lot of people are missing the ligament. They don't think of it as a key component in the problem. And a lot of times it's the cause, not the effect. Ligament really just sets the tone of how the spine is going to move. And when it can't move right, it causes a lot of different problems. So what I wanted to include in this week's breakdown is two things. One is an advanced palpation of finding the supraspinous ligament, because a lot of people actually don't know how to find it and where it is. And if you can't find it, you can't fix it. And lastly, I'm going to demonstrate treatment using an instrument. We use instruments treatment on the ligaments in the spine in the Peak Method, going through and doing what I call instrument scar tissue treatment. So first you're going to see the palpation video, then you're going to see the treatment video. So next thing we're going to do is we're going to go right into the palpation of this. So I have all my landmarks in here, and essentially what I'll do is I'll find PSIS, and then I go over, and then a little bit over here, I know that I'm on the spinous of S1 and L5. So the first thing I'm going to check is I'm going to work my way up, and I'm going to feel for the supraspinous ligament all the way up to the thoracic spine. And what I'm feeling for is where there's tension. And a lot of times you're going to find that tension where that spot is limited. Treating the supraspinous ligament, after you've done that pencil test, you found that area where it's not flexing how it should, and all that space in there, you're going to know where to go for the treatment. So the first step is to actually treat that area. So you're going to have them down in this quadruped position on all fours. Key here when you set them up is you want the legs to be nice and parallel, straight down, hip and knee line up, shoulder and wrist line up as well. And the first step is you're going to have them sink that belly down just like that. And then you're going to have them crunch up just like that. And then basically we're going to go in that area where that flatness was and where that decreased compressibility is. So anytime we're treating with the instrument, we always want to use the lotion. And what you're going to do is come up just like that. And you're going to have them hold that position. You want this to be nice and relaxed. A lot of times when people go up, they'll get too much of this, and we don't want that. What we really want is a couple cues. We want them just to crunch the belly up, and then you can give them a little cue where you tuck down the butt, just like that, and that's where you need them to be. Now, we're going to get in here. I'll come close now. Now we're going to get in here and identify different types of landmarks we talk about in the palpation as well, but basically here's the PSIS, and then over here, and where that ligament is getting jammed up is in through here, in through here. You can see as I'm rolling through, this is a spinous, that's the ligament, back on a spinous, back down again. Now the key here is you want to hold back some of that tension. So what I'll do is I'll take my fingers and grip that, and I'll pull that up. That allows that to get some of that tension. You're going to get in there with the instrument, and essentially you're going to sink in, back off, and you're going to pull that up. And what you're going to find is just do some
diagnostic passes to find the area where the most grit is, and I'm finding that right there. So now I'll landmark, and I have one of the spinuses, the other one there. I know I'm going to be in through there, so I'm going to hold tight. I'm going to be able to sink in, and I'm going to pull up and come out just like that. I'm going to sink in, pull up just like that, and then each time you might want to get a little more motion because that's going to start to open up. Sink in and pull. Get about 5 to 7, maybe 8 or 9 in this area because it can take more, and then move up to the next one. You always want to find that landmark so you can see I can really sink in here, and then each one of those spinuses. So I'm going to start just there, and I'm going to pull through, come up, sink, pull through, sink, pull through. You're going to work your way up and find that area where that decreased compressibility is and get some of those passes, because the rest of the lumbar treatment won't work until you free up that ligament. And the really good part about the instrument treatment is once it's had enough, it starts to get red. You don't want to push it any further than that. A lot of people go too hard and it actually creates too much inflammation. So you want to have enough just to get a red feeling in there. And essentially that's the body's way of saying it has enough. You always want to do less is always better than more because you can't go back from that. So we find some redness and then we know to leave it alone and let it chill out.
Hope you got something out of that. If you liked the video, give it a comment, a share, share it with somebody else that might need some new type of perspectives and changing their mind and getting into more of a functional based type of treatment model. Go get our free training. You're going to learn all this stuff, thinking critically, advanced treatment, all that kind of stuff. Come take one of our seminars, listen to our podcast, follow us on all the social medias. And, I really appreciate all your support, and I'll see you guys on the next one. Bye.